My name is Mark Urban. I'm an emergency physician here in Boise, Idaho, and I took over as Access Co-Medical Director on January 1st, 2020, when Dr. Butler Hall went over to New Zealand. I'm currently the Chief Quality Officer for Emergency Medicine of Idaho and the Department Chairman of Emergency Medicine at St. Luke's. I'm also the Vice Chairperson of the EMS Physicians Commission with the State Department of Health and Welfare in Idaho. The first thing is there has been a ton of misinformation regarding both of the vaccines that are currently have FDA emergency release authorization. The first one to receive that special authorization was the Pfizer vaccine, which rolled out just a few weeks before Moderna received their emergency use authorization a few weeks later. Both of them use the same vaccine technology, which is an mRNA driver. A lot of people have brought some concerns around that being a new technology, and the first rumor I'd like to dispel about that is it is the first vaccine to be distributed based on that, but the technology itself is not new. It's been in development for over a decade. In fact, Moderna is the big company behind that. If you look at Moderna's name, mRNA is in the name. That's why it was being developed. And it was specifically around MERS as well as SARS, which are both coronaviruses that directly impact that part of the world and actually directly impact our troops that are deployed in that region. So the development of a vaccine against MERS, which is the Middle Eastern respiratory virus, as well as SARS, which are both in the coronavirus family and the same as COVID-19, there was some utilization for that. So the technology around the mRNA driver for vaccination is huge, and it's actually going to be the future of vaccinations in the US and worldwide. So the first rumor to dispel is that it's not a new technology, and it's been being studied for over a decade. Just a little background about the numbers that I personally experienced. As Department Chairman of Emergency Medicine with St. Luke's, I'm privy to all of the incident command structure within the COVID incident command with St. Luke's. And as of to date, we've distributed within the health system at St. Luke's over 10,000 doses. 10,000 providers have received it, which is about 53% of the health staff in general, which includes everybody who works in the cafeteria, EVS, which is our cleaning staff, have received that first dose, and 8% the second dose, because we're just at the point where everyone is receiving their second dose. I received mine last Friday. And we are utilizing the Pfizer vaccine. Add that in, we had the 475 here through Access, as well as the network of other physicians and medical directors that I've been in contact with around the country. What we do know and what we've seen after the first dose with both Pfizer and Moderna, there are some minor side effects that I would relate my own personal experience came after the second dose. But with the first dose, I had a sore arm, as if someone had punched it for about 2 to 3 days. In fact, it didn't limit my ability to go and work out or do anything. And that was the general consensus after the first dose, was a sore arm. And very similarly with the second dose, and they warn you, statistically, most people are going to have some effects of the second dose. That means it's working. That is your immune system ramping up. And you will experience fatigue. You can experience body aches, chills, headache, nausea, in some cases vomiting and diarrhea. But what I have anecdotally experienced with friends ranges from no symptoms at all to generalized fatigue. And in my own personal experience after my second dose, generalized fatigue and some chills. But within 24 hours, I was pulling my 2 kids up a hill on a sled, and it really didn't adverse affect. What we are telling everyone is that you should plan for at least 24 to 48 hours after your second dose to just relax and be at home and be prepared to experience some side effects. What we don't want to experience is a lot of people getting the second dose, experiencing a bunch of side effects, and then not able to work because of it. This has come up several times, even within the Access Vaccine Clinic. does a reaction or a certain reaction disqualify you from the second dose? And the answer to that is the information is available. If you have a reaction to the first dose, talk about it with the providers at the vaccine clinic or the medical directors, because we have a very good list of which conditions would then disqualify you for the second dose and which conditions wouldn't disqualify you in our expected reaction. So the information is available. So if there's any question about it or any hesitancy, please reach out, because we can dispel some of the misinformation about that. One of the other questions that we've dealt with is if I've had a prior infection with COVID, should I get the vaccine? And the answer to that is very simply yes. There is a time frame that you should wait from your symptoms, and it's basically the same as we use for return to work. If you've been asymptomatic for over 48 hours, but there is a clear window of when the vaccine can be administered to someone who's had a prior infection with COVID. And the reason we're recommending anyone who's had a prior infection with COVID get the vaccine is that we just simply don't know what prior infection offers in ways of immunity to COVID. We know that you can get reinfected with COVID. We don't know what that time frame is. There's some research coming out of the UK right now that infection with COVID offers roughly 5 months of immunity. But the problem with that being is that there's no time distribution for COVID. There's no season of COVID like influenza. So the problem is it's still rampant in the community. So if you've had prior infection 6 months ago and you have no immunity against it, it would only stand to reason that be part of the vaccination protocol. Vaccination producers actually say that someone who's had a prior infection with COVID will likely have more of the side effects after the first dose and not likely to have any of the side effects after the second dose. And that's to be expected, is because you think about the way the immune system works, it's already ramped up and will recognize the vaccine and do what it's supposed to and think it's basically getting turned on again from an infection, where the second dose won't cause, likely won't cause as significant a reaction. But that is to be expected. If you had a prior infection with COVID, that the first dose may have more side effects than someone who has not had the COVID infection. Biggest thing is there's a lot of misinformation out there, but we have a lot of folks within the Access system who have done a lot of work around collecting appropriate information and data that can help anyone on the fence make an informed decision about what is going to be best for them, their family, and the community. Again, it's not a mandatory vaccine. It is pure voluntary, but I think it would be worthwhile if everyone who is able to participate gets the vaccine. I'd rather not be controlled by fear or the unknown. I rely on the science behind it. And what I tell most folks is it's not a mandatory vaccine. This is voluntary, and everyone needs to make an informed decision. And the key behind that is an informed decision. Make sure that you're basing it on the right facts and the right data that has been provided. And there's a lot of great data coming out now. In the United States, over 5 million people have received either the Moderna or the Pfizer vaccine. The rate of severe allergic reaction is 1%. It's minuscule. It got a lot of media time, which was unfortunate, because it really was a driver for more misinformation. And we've heard everything from sterility to, I can't even begin to tell you all the rumors we've heard, but it's important to make an informed decision. And there are a lot of avenues for that, either with the physicians, different internet outlets. The CDC has a ton of information regarding that. And that's what I would recommend. Personally, I recommend everybody get it if they don't have any absolute disqualifiers. And there are some that would disqualify folks, and those are very straightforward as to who should not receive the vaccine. But if you're able to, I highly recommend it.